4 a.m. At that time, is very violent, and he was telling that he thinks that his tongue is being pulled inside, and he was very violent and is bit severely in the tongue, and he has almost pulled out his tongue. So that connection between tongue and mouth was almost broken, and severe injuries in the tongue were there. And first they gave him sedation, and by around 5:30 or 6 a.m. he was brought to a sedation stage, and they told that emergency doctor and who was there at that time told that for now he'll be admitted in the ICU, and that surgeon will come, plastic surgeon will come and do a tongue surgery. So at around 10, and she came on that time, and she explained where and all that injuries and there and what she will be doing. And maybe around 1:30 to 2 o'clock the surgery was over, and she told everything is fine, that they have done their part, and that next was that this is not the cause, this is not the actual problem, some other problem is there that we have to look into. And he told her if we come back again to a normal stage, there are chances of again him biting the tongues again, and then it will go to a bad stage like that, she told her. But they gave he was under sedation for almost that day, he was under sedation, and no further problem was there. For the services, I really thanks Dr. Chennamma and Dr. Kritika who had done the surgery, and Koshys Hospital for doing their job, doing their part very well, and it was all went well.
Hi, this is Dr. Shrikant from Koshys ICU team, Intensivist here. Vivek Damodar came to us with a seizures and sudden onset of psychotic activities in home brought by her wife. While examining, there was a massive bleed from the oral, and the tongue was split into two, and there was a violent psychotic activity. So we initially stabilized him with the sedations and other bleeding controlling measures. Then we took him to the ICU, did a CT scan and other neurological assessment, and timely intervention of plastic surgeon was done, and there was a fine suturing to the tongue. Next 24 hours the patient was almost stabilized. Then we extubated him, and we just shifted to the ward. Prior to that, all neurological assessment and interventions were done. So patient was stable. Later on that, he was able to talk, he was able to move his tongue well. So the stress life and work from home, social media impact, all things has bursted it and caused so much of stress. So the takeaway is we should balance the life with family as well as work pressure. Both if we balance, the life will be good and healthy. Thank you.